As we head up to 6:30 this morning, let's focus on those who risk their lives every single day to save all of us. Imagine how difficult that is at a regular time of year. Now add COVID-19 to it, and it's threatening to engulf Gauteng, of course, and the potential tightening restrictions on the cards as well, as government continues to consult with its scientific advisors and experts. But here's something I've been wanting to ask for a long time, as we cannot forget how important their jobs are. How are our emergency medical services coping during this time? EMS, of course, Gauteng Emergency Medical Services, Acting Operations Manager-JP von Benecke, joining us to tell us how everyone is actually doing. JP, good morning to you, and I know it's a loaded question. You have a difficult job at the best of times. It's now, let's call it a year and a half into COVID-19. Just give me an overarching view, if you can, just generally morale-wise. How's everyone feeling?
Good morning, guys, and the viewers. Yeah, it's I personally, together with my staff, are definitely feeling a little bit more strained this time around. And if I could just put it in perspective, during the first wave, we were still in quite a severe lockdown. So our general call volume and trauma and the calls that we would normally expect to serve went right down, so we could focus a little bit more on COVID. And even during the second wave, there was quite a strict alcohol ban, so that decreased our trauma-related calls quite significantly. And now, currently entering this third wave, there hasn't been any strict measures in place. So our normal call volume still exists. On top of that, we've lost one of our big hospitals that usually takes quite a large volume of our patients off our hands. Because EMS has to drop them somewhere. And now we have this third wave. It's at this stage we're doing close to 200 calls on top of what we usually do, and it's putting tremendous strain on the guys. Like if you just follow the social media accounts of some of the EMS staff, you'll see they are absolutely exhausted because you have to be on your guard the whole time. You have this virus looming over your shoulders the whole time, and in the meanwhile still have to treat a gunshot or stabbing. It is really putting, I think, mental strain more on us than any other time in my whole career.
Can we talk about the hospitals for just a moment? Not the politics of hospitals, JP. We're not going to talk politics. We'll leave that to those who want to talk about politics. Having a big hospital like Charlotte Maxeke taken out of the line at the moment, I've been seeing reports of having patients in ambulances, frantic family members posting on social media. The ambulance is driving around with a sick or dying COVID-19 patient and simply nowhere to go. Is that really what it looks like on the ground, driving around the province, trying to find a bed for a critical patient? Is that where we are?
It's almost there. Luckily at Gauteng Emergency Medical Services, we've got measures in place to mitigate this from happening. I think if you don't have that sort of support, or you're maybe a smaller ambulance service and you don't have the backing of the Department of Health, you certainly might struggle to find a bed. We luckily have quite a large internal structure and measures to escalate these type of problems. But that being said, we do have problems at handover. Our turnaround times at hospitals have increased considerably. So it means we would normally go to an hospital and hand over the patient within 10 to 15 minutes. We would now probably spend from half an hour to an hour just to find a bed for the patient, for the hospital to take over the patient. So it does, in some way, put a lot of pressure on our mission times as well.
Can we talk about vaccinations? Have you guys been vaccinated?
Yeah, so the vaccination uptake from healthcare providers in EMS, especially on our side, initially was a bit slow. I think it's been taken up quite more seriously now that I see the effect of the third wave and the current strain that we're dealing with. But EMS, it was sitting, I think, at about 75% of our staff vaccinated, and that we can see in our staff infections this time around, which is quite interesting. So if you look at the national curve, especially in Gauteng, it climbs very steep in this third wave if you compare it to the first and second wave. And if I look at how many of my staff picked up the virus during the first and second wave, was also very significant. And this time around, I've got very little staff. I think we're reporting less than one staff member per day testing positive for the virus, and that says a lot about how effective this vaccination actually is.
JP, just before I let you go, two things. If you can answer this in the same question, because I want to get this answer from you. From the daily structures, the support you need as EMS, what would you need to try and make your lives easier from government or whatever structure it would come from? What does that look like? And then two, on the lockdown, you mentioned alcohol earlier. What would you do in Gauteng as far as the lockdown restrictions concerned? What do you think? As a final question to you.
Yeah, that's a tricky one. Personally, I think it's a bit late for maybe a too strict lockdown, but I would certainly consider an alcohol ban at this stage. Trauma volumes are still significant. Even this last night, I think we had 7 or 8 gunshots just in this province. And at this stage, there is really no capacity for these trauma cases, because we have to focus on all the respiratory distress type of cases, which is related to the flu season, and a lot of people develop pneumonia and bronchitis, and then on top of that now you have COVID-19 as well. So my biggest wish is just that the public is a little bit more responsible out there now, be cognizant of this current wave. It is a significant wave. It climbs very, very steeply now. We see a lot more children getting infected now, which also carries, or very good carriers, so almost all vectors for this virus. So if I can really plead to the public is to make sure that you follow all the non-pharmaceutical measures, like sanitizing your hand religiously. So if you do not need to go out the house, stay at home, wear your mask wherever you go, and if you are sick, please isolate. We're getting a lot of reports of people testing positive, but they're feeling fine, so they don't tell anybody, and they still go out and go and shop. So that's my biggest plea, is just to use the system responsibly and give the healthcare system and EMS just a chance to get through this wave.
All right, and from your mouth to everyone who's watching's ears, JP von Benecke, congratulations, and thank you as always to you and all the incredible hard-working EMS staff in Gauteng.